This segment is proudly sponsored by Zbrana Productions.
It is RB2, your station of choice. A very good morning to you if you just joined us, and you are right on time. A Broken Body series courtesy of our Dr. Baggett, and that's where we are. And we continue down the ladder with the commonest diseases affecting the globe. Today we chat on lung diseases. What is asthma? Who gets it? Why do they get it? Is it genetic? Can it be cured? If not, are there medicines that can allow a normal lifestyle? What happens if one is not well controlled? We'll also focus on what is bronchitis? What is emphsema? Who gets it and why? What are the symptoms? Is it rather life-threatening? Can it be prevented? And joining us on the line, we are joined by Dr. Baggett. Dr. Baggett, good morning to you and welcome to the program.
I see you read those words out like you're a doctor.
If I'm in the company of a doctor, I think to some degree that somewhat makes me one.
I think you struggled with the emphsema, but you got it right. Yeah, we're going to be talking about lung disease. We're actually going down the ladder of the commonest conditions affecting the globe. We've talked about heart disease and we talked about diabetes in the last couple of series. And the third prominent cause of hospital admissions and death worldwide is the condition called asthma, and another one which is called chronic obstructive pulmonary disease. Big words, but we'll talk about them and break it down and unpack it. But we want to talk about asthma because it's actually very common in our country. You know, we're particularly what we call an allergenic country, which basically means where we have dust, we have more mopani trees, we have the wind. This is a particular month of August where things change, and then you get the jacarandas. So we're exposed to lots of stuff, and a lot of people are going around without actually understanding that they're getting asthma. Just as a one-off, people think that asthma is caused by wheezing. Wheezing is asthma. But you may simply just cough on a regular basis, and that actually may be the only sign of asthma that you have. So it's really important. As a matter of interest, Prince, does anybody in your family have asthma?
My cousin did at some point, but she outgrew it at some point. I don't know how that happened.
Absolutely. It is something that occurs in childhood, God willing, it actually then disappears and you grow out of it. So it's often very common to occur in childhood, and it's a chronic condition, unfortunately, Prince, where it affects the airways. The airways, if you like, are the tubes that carry air in and out of the lungs. And in people with asthma, the airways are sensitive and can become really angry and inflamed and narrowed down and makes it difficult to breathe, and that's when you get the wheezing. And of course, obviously the symptoms are wheezing, cough, shortness of breath, and asthmatics describe the sort of chest tightness where they're trying to get a breath in, but they can't because those tubes are so tight they can't actually breathe. And unfortunately, even today in our hospitals and clinics, we actually sadly do have deaths from asthma, largely preventable because people aren't either taking their medication or haven't actually been picked up early. So it really is important in terms of people listening that if you have a cough and only a cough on a regular basis that a doctor can't find anything, it may be asthma. Causes of asthma are not really fully understood, but allergies, it runs in families, exposure to certain environmental triggers. If you have, for example, other allergies, like you get a skin rash or eczema or, your nose runs, you get sinus problems, they're all part of the same umbrella. So, your brother may have allergies of the skin and you may have asthma, and your sister may get chronic sinus conditions. So it's the same sort of condition that triggers these things. And we can, as doctors, diagnose it just by a simple physical examination or do very sensitive tests like lung function tests. But really, really is important out there to understand that and to take the treatment. Now, there's no cure for asthma, but treatments can help the symptoms and improve the quality of life. Do you know what the treatment for asthma is, Prince?
Spray?
Absolutely.
From the top of my head.
Absolutely. And people, you like to use the word sprays, but actually inhalers. Sprays are the things you put up your nose, but inhalers are things that you actually breathe down into your tubes or lungs. And these inhalers, there are different types of inhalers. They're long-acting, short-acting, preventive inhalers, and these are all on the market, available both in the public and the private sector. And please use them. People often feel, if I use this stuff, I'm going to get addicted to it, or it's not going to work, and all this, and there are lots of side effects. There are very, very few side effects, and of course, the biggest issue is you don't want the side effect of death. That's a bigger issue than these inhalers, and they are really very safe. Besides the lifestyle changes, and of course avoiding the triggers, which we can't so much in Botswana, because we've got the trees and the pollen and the jacarandas and the dust and August, month of August. So you can't really avoid some of these things, but try where possible. Sometimes a mask may help, and adopt your lifestyle changes. But take your inhalers if you prescribe them, and they are available by a doctor's prescription. So this is really important. If you're really, really small, below the age of 5, we tend to use pills that actually stop the airways from becoming angry, and children are often given pills and a little bit of a nebulizer to help them open up their lungs. Okay. So long-term prevention of this is really, really important. And I really want to emphasize, because people there will say, Naka, this thing is a steroid. I read the label and steroids are bad for you. We wouldn't give you something if it was that harmful for you. They are steroids, but they do help. They are not adaptive or addictive, and people need to understand that that's really important. So just wrapping up before we move on to a more serious condition, living with asthma. People with asthma can actually live a very full and active life, and I have lots of patients who are actually good, strong swimmers and athletes and runners who manage their asthma just like diabetes. They manage their diabetes and asthma very well and have regular active lives. So take your medication, avoid your triggers, get some exercise, stay hydrated, all the usual stuff we talk about every week. Manage your stress, because stress can trigger your asthma, and see your doctor regularly for checkups. If you think you have asthma listening to our conversation, please talk to your doctor or your nurse or your hospital. They can help you diagnose your condition and develop a treatment plan. So that's really asthma. I'm going to pause there, Prince, if you have any questions.
None at the moment, but my take home is, just be alive to pretty much the changes. And just quickly, maybe there, I could just chip in. When we transition, like your season change, how does that affect a person who might have this condition?
Absolutely. Good question, Prince. So what we advise a lot of our asthma patients is work out which part of the year triggers you. In some people, it's the winter and the cold. In others, it's August, September, when we don't really have spring. But when the weather changes, from cold to hot, and the wind blows and the leaves fall, etc. People get asthma during that time as well. Some people get asthma when it's the perfumes and any time, air conditioners, sprays, etc. So those ones, avoid those, or use your asthma inhaler regularly. So depending on the change of season, what we do is we tell them to regulate, to take an inhaler twice a day or 3 times a day or once a day. So we'll adjust it. But please speak to your clinician about how you adjust your treatment. They really are very safe.
Okay. And just maybe in closing that part of our conversation, in an instance where a patient, maybe gets an attack and they are not with their inhaler, what can those around them do to assist in that regard whilst they're waiting on, a medical practitioner to be on site?
That's a really good question. So lots of air. Get outside, open the windows, tell them to calm down, take as big a breath as possible. If the individual has forgotten their asthma sprays or they have a pill, we often give particularly severe asthmatics what we call a pill in the pocket. So keep this pill in your pocket in case of emergency. And they usually are oral tablet steroids, which actually work within half an hour. In hospital, we often give them if they are resistant to asthma. So often asked, do you have a pill in your pocket? Do you have something that you can take that can actually relieve it? If you can't, and the asthma is getting worse, and the chest is getting tight, take them to hospital, because these are readily reversible causes of death. And sadly, we do lose some, because sometimes they come in with the airways so narrow, we can't even actually put them on a bed. Not getting any better, and you've forgotten your sprays, or you're in a situation where you ran out, go to the clinic or hospital. We often have those, or we can nebulize you. It's really important piece of advice.
Okay.
So we're going to be talking about one other condition, but we've got very little time, but it's a really important condition. We may spill over into next week, and that's called chronic obstructive pulmonary disease. Complicated word, but they're conditions that we call emphsema or bronchitis, and you see them, they generally occur in middle-aged to elderly, mainly people who've been smoking, people who've been working in mines, underground, people who've been exposed to TB and they've damaged their lungs. So it's pre-existing chronic exposure to, and the commonest ones in our country are smoking and mining exposure. We have lots of mines, and there are mines that are growing up all over the place, and there's dust, you're inhaling that stuff, there's chemicals, and eventually destroys your your lungs. An old one is asbestos. We don't mind it anymore, but asbestos causes the chronic damage to the lungs and causes difficulty breathing. And unfortunately, it occurs 10 to 15 years after the patient has retired. And often we struggle to get, compensation for these guys. And some of our old monomoholos have had exposure in mines in Johannesburg, and we can't actually contact them because the mine is either closed or they will refuse to compensate, because these things are unfortunately conditions which are not reversible. We can actually manage it by giving a different type of spray or inhaler, but unfortunately the sad news is once you develop this chronic obstructive pulmonary disease or bronchitis, it is something that is very difficult to manage and treat, and we manage on a regular basis, day to day, managing the cough, managing the sputum, managing the phlegm, managing the shortness of breath. Sometimes they're oxygen dependent, and they're continually wearing oxygen masks, and eventually they are admitted to hospital in a really sad state. So it's really important. Obviously, in this condition, prevention is better than cure. So definitely, stop smoking if you're a smoker. If you are or have been a smoker, go and check your lungs, get a doctor to listen to your lungs, get an x-ray. If you're having shortness of breath and it's not asthma, and you have some of these conditions where you've been exposed to a mine or chemicals or smoking, go and see your doctor. We can actually do lots of things to pick it up early and to manage it early. So again, take your medications prescribed by the doctor, quit smoking, avoid air pollution, get regular exercise, get enough sleep, and see your doctor regularly. These are the bottom lines for chronic obstructive airways disease. A lot of people have it, particularly in the central and the northern areas of our country, where there are lots of mines, and particularly Piquet area, and now increasingly in my own area, we have lots of people between the ages of 50 and 70 who have this condition, often untreated. They just think they've got flu, and they take regular antibiotics rather than be seen by a specialist who can manage the what we call COPD, chronic obstructive pulmonary disease. Any questions, Prince?
Not at this level, Doctor. But if you have maybe would like to get in touch, appreciate things that we might have not shared on this platform. Are there avenues? Are there platforms where patients or those who are caring for these patients could access information that is very critical in caring for their loved ones?
Great one. If you are out and not in Gaborone, then go to your doctor or your clinic, and they will actually refer you to a specialist. The specialist is called a pulmonologist, which basically means a lung specialist, and they are scattered around the country in the tertiary hospitals and in the private sector. If you need more information, it is something that most doctors at juniors are trained on and will refer you appropriately for the right things. In terms of us, you can go to our Facebook page, the Heart Foundation of Botswana, and ask some questions, and then we've already got regular readers on that stuff. So it's Heart Foundation of Botswana, and we will answer some of your questions as to what these things are. One last parting arrow is that those people with chronic bronchitis and emphsema, it's really important that on an annual basis you take the flu shot, which is usually in Botswana around March, April, and also the pneumonia vaccine. These vaccines, I know vaccines got a bad rap among some people, but the vaccines for pneumonia and the vaccine for flu are a must for patients who have these long-term chronic conditions, because a prevention of a flu-like illness, particularly with our COVID era, and also pneumonia with a pneumococcal vaccine, the vaccine is almost 70 to 80% protective against getting really bad pneumonia. So get your pneumonia vaccine on an annual basis, get your flu vaccine. They do work, they do help. And your doctor or your clinic or your facility will give them to you if you're the right type of person.
Fantastic. Dr. Baggett, let me thank you once again for your time. We shall catch you again next Saturday, same place, same dial.
Thanks very much, Prince. Next week we're going to be talking about cancer, the dreaded word cancer. What is it? Why do you get it? Who gets it? And what are the treatments and prevention for it?
As we wait on next Saturday.
Cool.
Good day.